Hi, my name is Chelsea Peters, and I am going over the email that I sent you with the notes on the Oxford Healthcare Diabetic Clinic that we'll be setting up in the Springfield, Illinois area. This is an urban development project that will be treating individuals that have type 1 and type 2 diabetes. Also, these individuals are going to be the individuals at this community clinic that come in because they cannot afford healthcare treatment for their diabetes. These individuals that live in this area, about 19.3%, as you see in the notes, are living at or below poverty line in the area. These individuals don't have Medicare, or may not have Medicaid, or may not be getting public aid health care services, and they are not getting treatment for their diabetes, and their conditions are rapidly decreasing. These individuals are young individuals with type 1 diabetes, or even older individuals with type 1 or type 2 diabetes. They may not have a glucometer or be educated properly how to take their blood sugar checks. They may not be affording their insulin. They may not be taking their proper medications. They don't understand the nutrition aspects to monitor their blood sugar levels properly. And they may not understand that they even have diabetes because they may not have seen a physician in several years, and they're just not feeling well, and they have not had it actually documented what their diagnoses are. For this project, I have sent you a outline of the different areas that we will be focusing on in the marketing campaign. This will be for individuals that cannot afford treatment. We will be seeking out individuals that live in the community and the surrounding areas. For our marketing campaign, our strategy is to develop community engagement plan by reaching out and advertising to these individuals through pamphlets and brochures with community care providers such as caseworkers with senior services, caseworkers with Illinois Department of Aging, caseworkers with Agency on Aging, and caseworkers that work for Department of Public Health and Human Services. We'll also be reaching out to local and area doctors to let them know that we are collecting data and offering free services to individuals with diabetes so that we can work with them going forward to develop our research, monitor our clients, and get client referrals for individuals that perhaps no longer have insurance or cannot afford to see a physician anymore. We'll also be advertising on local radio stations, public television stations, and basically newspapers, and the research shows that this local advertising, straightforward, is really the kind of advertising we want to do for the demographic that we're marketing to. Our target audience lives in the community and is going to be watching TV, is going to be reading the paper, is going to be seeing caseworkers through one of the government programs, whether it's federal or state level. And these are the clients that we want to reach out to, and their caseworkers are going to be able to give us some good patient referrals for the clinic. Part two of our marketing is to involve our stakeholders in our marketing campaign and let them know what opportunities are out there, how we're spending the marketing budget, and as we get the clientele in, keeping the stakeholders involved in the progress of developing our clinic and its research. We will be at the clinic hiring physicians, nursing staff, where we're hiring RNs and nurse practitioners. We're also planning on hiring several specialists to work in the office and handle the medical data research, monitoring the data input for the clients, and working as receptionists in the office. We'll be utilizing those particular staff. We'll also be looking to engage the community for volunteers that want to work within the clinic for workshops that we offer in the evenings and weekends. These workshops that we're offering will include nutrition presentations so that individuals can understand proper diet to manage their diabetes. This can also help keep down their frequent visits to the emergency room if they eat proper diet, manage their medications, and get proper exercise. So these workshops will entail a whole holistic way of treating the client, not just monitoring their meds and giving them their diagnoses. We will be teaching them how to use their equipment in these workshops, and we'll be teaching them about proper health and fitness to get some of that recreation in and maintain a proper healthy weight to help monitor their type 2 diabetes, which can end them in the emergency room if they continue to live the lifestyle that maybe they did not know they were living that was leading to these conditions. Basically, these educational workshops are going to help the patients, when they go home, do the best for themselves and empower themselves to take care of themselves whenever they're not in the physician's offices. This will keep down the cost of their healthcare expenses if we can help them maintain and monitor their diagnoses themselves. We'll also be utilizing new information technology services such as telehealth services and in the office monitoring data research and using flow sheets with the new information technology to better utilize our staff's time so that we don't have to hire an excess of staff since we are running a non-for-profit clinic, but also so that we can develop our own research and learn and grow and see what the community needs really are as we take on new clients on years 1, 2, 3, all the way through 5. I've done a financial budget for you guys to get an idea of our target audience and how we'll be spending our money and how we'll be utilizing the clinic over the next 5 years of the campaign. One of the other things that I marked in part 2 and part 3 of the outline is that we want to offer these diabetic services free to individuals because they cannot afford it, and that there is over 180,000 individuals within the surrounding area of the target audience that do have diabetes. So there's definitely the market there for the clinic to be utilized effectively. And there is definitely the need there for individuals and the individual referrals to grow over the next several years as we're able to take on more clients once we become established. One of the important things about this marketing plan is that we are minimizing our operating risks and we are minimizing the expenses, and we're utilizing our time better with the information technology services. So we will be able to have minimal staff and still provide effective health care to the patients in this area. As I've attached a pro forma income statement to this to get like a mock study of what a diabetic clinic in the area is operating on budget-wise. I utilized my information and data collection from another diabetic facility that offers a similar approach in a nearby area of a similar demographic within Illinois, known as Carl Clinic. And they, on average, grew their population by 5% each year, year after year, in a very similar structured environment. So we use them, and after 10 years, they are showing that they have really grown their clinic over the years and been very successful in offering diabetic treatment at their facility. The last notes that I went off of were published in 2017 on their website, which I have cited at the bottom of my research. Also, the second objective of this clinic is to, by December 31st, 2019, establish a snapshot of what diabetes looks like in our community and use that research to show what the standard methods are and multiple community resources to share our data with them and them share ours with us so that we can better understand our clientele, the needs, and the services that we offer them. We also want to develop different methods of data collection. Maybe in the first year when we look back, we see that we can improve our services by offering surveys to the clients and to our staff, and then we need to change the direction in which we approach our services. We may need to offer more care to more patients sooner, but we also may need to develop our plan to better service our clients individually if we're not doing so immediately on the first go around. So the big part of the marketing plan is also to continue to survey our patients and make sure that we are giving them what they need so that they give us positive feedback, but also so that they refer us to other people within the community to help grow our census and give us positive ratings and reviews to their friends and family in the community that may also end up being patients of ours. Through this data and monitoring and target communication and marketing strategies, this big broad approach will really help the clinic to grow, but also grow the awareness of diabetes within the community and the services that we offer for those individuals in the community. It is a very high risk population, and monitoring their health really helps reserve the waste of unnecessary healthcare expenses down the line for both them or their families, but also for Medicare and Medicaid. These individuals, if we can keep them out of the hospitals and maintain their health, it really will save dollars overall. And that is really everything I have. If you have any questions, feel free to reach out to me via email. My email address has been attached to the notes I sent you. And if you have any questions going forward, I look forward to your questions. Thank you very much, and have a good day.